Hello students, welcome to GPAT revision session for 2024. We are going to start with the subject pharmacognosy. So without any ado, we move towards the questions. Match the types of terpenes under column 1 with their respective examples under column 2. If you see in column 1 you will find monoterpenes, diterpenes, 6-terpenes, theta-terpenes. What the carbon count for this? For monoterpenes, it is 10. For diterpenes, 20. 60-terpenes, 50. And tetraterpenes, 40. In column B, we will see which terpene will have what carbon count. Lycopene is C40, camphor is C10, taxol is C20, and gingiberine is C15. So when you try to match up, the answer will be B, that is A to B3. Let's move to the next question. The following classification of herbal drugs gives better understanding of bioenergetic pathway in drug. Bioenergetic pathway leads to the synthesis of primary and secondary metabolites. So they are chemical moieties. So answer 4 is the correct answer. Chemical classification. Give Given below are two statements. One is labeled as assertion A and the other labeled as reason R. Assertion: the Ayurvedic drug asava contains self-generated alcohol. Reason: for preparation of asava, the extract of drug is subjected to a process of calcination. Now, we all know that asava having alcohol in it is self-generated, but there is a process in which the core of the metal is heated to a high temperature in the absence or limited supply of air or oxygen. So, in Asava, we do not need a process of calcination. So, if you go through the options, the option 3, that is A is correct, but R is not correct, is correct option. The ring structure present in strychnine is. Now, to understand that, we should know the structure of strychnine. If you see the structure, the basic building block or skeleton is consist of six-member hexagonal ring with the five-member end containing ring. That is called indole. So the answer is one, indole. Marker compound analysis is one of the useful methods for evaluation of herbal drugs. The following statement is not true about marker compound analysis. Number one, used to verify potency or identity of herbal drug. That is correct. The standardization method will lead to the identification and calculation of potency by using marker compound. Quantification of marker compounds can be carried out by HPLC, HPTLC, and GC. That is also correct. For quantification, we use a sophisticated technique such as HPLC, HPTLC, or GC. The marker compounds are generally secondary metabolites. That is also correct because not always they are secondary metabolites. Some marker compounds can be primary metabolites. For example, sugars, amino acids, or lipid moieties. Option 2, that is compounds are always therapeutically active. That is incorrect. They are not always therapeutically active. There are few markers which are only present in the plant and they can have or cannot have the activity. That's why they call a marker compound. So correct answer is option 2. In aloe, the mucilage containing parenchymatous cells are present in. To understand that, just look at the section of aloe. If you see the outermost green color is the pericyclic lining. Below pericyclic lining, you have a pericyclic vascular bundles, and below that you have a parenchymatous cell in the center cavity, in which mucilage is present. The latex of aloe is present in pericyclic fibers, which is part of pericyclic bundle. So, answer A, central parenchymatous region is correct answer. Match the following under chemical compounds under column 1 with the respective chemical test under column 2. Quinine, decoxy, quinine, etoxin, atropine, sinusides. Quinine and atropine are alkaloid, where digitoxin is a cardiac glycoside and sinucide is an endocrine glycoside. So, digitalis gives you detoxin, which can be identified by killer test. Then atropine and quinine are alkaloids. Atropine is known by Vitalimodin test, quinine is known by Thalluquine test, and sinucide is identified by von Trager test. You can also remember by this way quinine, thalloquine. Both consist of a quin, so by that it will be easy for to remember. So the correct option is option A or 1, that is a A2, B4, C3, D1. The fundamental principle law of similia falls under which therapy? Similia similex is the principle of homeopathy. That's why the option C is correct answer. Dragendorf reagent is consist of what? What is the composition of Dragendorf reagent? Now, to answer this question, I will elaborate which alkaloidal reagent consists of which ingredient. So, Wagner in the reagent consists of potassium iodide, Dragendorf reagent consists of potassium bismuth iodide, Mayer's reagent consists of potassium mercury iodide, and Hager's reagent consists of potassium picric. So, to answer, correct answer for this is B. So, with this, we have done a small review on pharmacognosy, and for such educating videos, please subscribe and like this video. Thank you.